Morning, everybody. I will say at the outset that today is the most concerning day of the pandemic that we've seen in New South Wales. I certainly will not be detracting from that strong message. We had 130,000 tests overnight, and very concerningly, we had 466 cases of community transmission. This is the largest jump we have seen in a night, and it's fair to say that we are on a par of being extremely concerned about the situation that we're in New South Wales. At least 60 of those were infectious in the community, but that number is likely to go up given a number of cases are still under investigation. Unfortunately, we had 4 deaths overnight, and we extend our deepest condolences to each and every one of the family and loved ones. As I say every day, we read out the statistics, but behind each statistic is a human being with loved ones they've left behind, and our heart goes out to all of them in these tragic circumstances. We had a female in her 40s who was in palliative care. She wasn't vaccinated at Concord Hospital who passed away. A male in his 70s, he was vaccinated but did have pre-existing conditions, who died at Liverpool Hospital. A male in his 80s who died at Concord Hospital who wasn't vaccinated, and a female in her 70s at Campbelltown Hospital, but we've yet to get further details as her death was only reported very recently, and we'll be able to provide further updates as they come to hand. As I said the last few days, we are seeing stabilisation in the Fairfield and Canterbury-Bankstown local government areas with ongoing decline in growth of cases. And pleasingly, those 2 local government areas have gone from low levels of vaccination to at least 40% of first doses, which contributes to the concerted targeted approach we've had in those local government areas. But the main suburbs of concern in and around Western Sydney and southwestern Sydney are, and I really want people in these communities to take heed, Blacktown, Doonside, Mount Druitt, Merrylands, Guildford and Auburn, where we're seeing the largest areas of growth. In regional New South Wales, concerningly, Western New South Wales, so Dubbo and the surrounding communities, has seen 26 cases overnight. And it is likely that health advice today will ask us to extend the local government areas in lockdown. Most of far western New South Wales is already in that situation, but there were a couple of local government areas outstanding, and I suspect we'll be getting that advice later today. Hunter, New England had 16 cases overnight. Armidale, Tamworth and Northern Rivers still remain at 0 cases, but obviously Health is watching those circumstances, and whilst Armidale still has 0 cases after a week, Health has recommended that that lockdown be extended for a further 7 days to make sure that there aren't any undetected cases, given the information Health received has changed from those concerned in the first few days of being detected as positive. So whilst those 3 areas have had 0 cases, Armidale, the community of Armidale will be asked to stay in lockdown for at least the next week.